Good morning, Heather.
Good morning. How are you doing?
I'm doing okay. How about you?
No complaints on my end.
Good deal. I just now saw your email, so I didn't set you as an alternative host.
Not on this one. You did on another one that I want to say. Where did you go? I had the email pulled up, and of course I. Okay.
I thought I had done it.
So the one that I am set up for is a grand rounds that's April 4th, May 2nd, June 6th, and June 4th.
Okay.
Unless I missed the email, which is totally possible.
I thought I had done it where it would just pull all the time, but maybe I didn't, you know. Because I will tell you when I have got to where we don't have to do the registration now that, we're tracking CME different. So I haven't been doing that. And you know how it doesn't pull, it leaves, if I do it as a template, I have to go in and change the template.
Right.
And stuff. And it, even if I change it, it will revert back. So I just decided, I'll just create a new one because it just seems to always have an issue. So
Right. Now that makes total sense, and it was getting kind of frustrating, so I get it. But yeah, no worries. I just noticed it and I was like, well, I can't pause the recording, so just recording me blank here, but no worries.
morning, Dr. Morris.
Morning, how are you?
Doing well. How about you?
A bit under the weather, but
Oh no, you sound like you have a little bit of a leftover.
yeah, no, I do for sure. So let me go through some things, I guess. Yeah, I'm gonna share my screen.
Okay.
You should see my desktop. Yeah,
Yep, there's your desktop.
I'll show a picture first. It's a little small, but there's a picture. Can you see that at all or no?
Yes, I can. Can
Okay.
you, okay, Heather?
Yes, I can.
Okay, I'm gonna close that. Let's go to the video. Now, did I click on the audio thing? Actually, I must stop share. I always gotta remember to click on that stupid audio thing. Hang on, I'll try again. Yeah, share sound. Do I click on the optimized screen for video?
I usually do.
Okay,
It tends to work out a little bit better, but I don't think it really like matters that much. But
okay.
Keeps ringing.
Okay, so you're not her.
No.
Thank you so much for fixing that. I appreciate it.
Can you see and hear that?
Yes.
yes.
Okay. Can you hear me talking while it's going or no?
Yes.
Okay, good.
While it's going.
Yeah, I'm gonna talk again. I'll play it again.
Okay.
My best friend in the
Okay,
whole
now I'm
world.
talking.
And she's here for you.
It's a little hard, I think,
Yeah.
so I'll probably have to pause it because it's pretty loud.
Yeah.
You could turn down the volume on the video maybe a little bit, and that might help because it's all the way up like on max.
All right. Okay, let me try again.
You too. We're all here for you.
She's beautiful. She is.
She is beautiful. Absolutely. Going out for us.
Is that better? Was that better or no?
It's hard to tell if you would talk during it.
Well, I may have to just pause it. That's okay.
Yeah. It is still pretty loud, even at the lower level.
Okay. Yeah, it's a fairly loud video. So I had the opposite problem. I was really looking for Griffin videos to show, but the audio is so horrible. Like, I mean, it's really hard to hear. Like, even turned it up max, you can barely hear anything. And I really wanted the verbal stuff, not just the physical interactions. But we'll make this work. It'll be fine. Then I've got a PowerPoint, but that should be fine. right. Okay, I think I'm good to go. As my kids get ready to go to school behind me.
Well, good morning, everyone, and welcome to Grand Rounds. Our speaker today is Dr. Clayton Morris. And our program is underwritten by an educational grant through OSU Medical Center, Graduate Medical Education. A disclosure statement has been signed and is on file in the Graduate Medical Education Office. Dr. Clayton Morris graduated from the University of Oklahoma Medical School in 2004 and OU Psychiatry program in 2008. He then completed a year of training in psychoanalysis with the Oklahoma Society for Psychoanalytic Studies in 2009. Dr. Morris started working for the Department of Mental Health and Substance Abuse Services, covering admissions and inpatient units, and in 2011 became the Psychiatry Residency Director. Then added Griffin Memorial Hospital Medical Director in 2015, and the Department of Mental Health Medical Director in 2022. He has worked extensively in the treatment of serious mental health illness, substance use disorders, and personality disorders. He also maintains a shrinking psychotherapy private practice. The Cloud CME activity code for today's Grand Rounds is 1636. That's 1636. Please join me in welcoming Dr. Clayton Morris.
Good morning. Let me first apologize for being a bit under the weather. Took my boy to camp last week, and this is how I returned. We had a good time though. So last time, actually 2 other plugs before we get started. One, we are building 2 new hospitals. The state of Oklahoma is. One is on the OSU campus in Tulsa, and the other will probably be on the OSU campus in Oklahoma City. So this is an exciting time to be part of mental health care. Okay, second, a little bit more dour announcement. So I'd like to remind you about the state's naloxone program. That is the nasal spray to reverse opiates. We give those kits away. We'll even mail them to patients. I'm reminded to do that because I had a cousin pass away this week from a very likely overdose. Okay, now if you were here last time, we talked about violence in healthcare. We're going to talk about that again today. I'm going to review some of the things that we talked about last time, and then we're going to go to video, and I'm going to try to walk you through what I think should have happened or should happen. All right, let me share my screen here. For some reason, it took away some people this time. Hang on. Yeah, normally it leaves that open. Okay, I'll do without. Okay, so here we are. That's me again. I don't have any financial disclosures. You can contact me at either of those emails. Okay, some things to remember. One, if things are violent, it may be too late for any approach that involves talking, although even then, often I have success. But you should assess your danger before you go into any situation. The first order of business is always to calculate how things feel. So I'm going to talk about from a physician perspective again, but remember our staff have issues. There's 2 types of violent persons, the psychotic and the shame-based. The shame-based is really about personality disorders. We're going to talk about both of those 2 parts today. That just a reminder of psychotic violence, it's really about fear. And your job is to really reduce fear and threats to the patient. And then don't forget that they're going to need some ongoing treatment after that. The second, which is actually probably more complicated, is working with personality disorders. And think about them as having emotional regulation difficulties. And then don't forget about trauma and attachment issues. I gave you some rules last time. There are in fact 8 of them. The first one, which I think I listed first because it is the most common one, and it also gets you into pretty big trouble. Don't take things too personally, and you don't need to be defensive in any way, shape, or form when you're talking with patients. Be a helper, not a savior. We talked about that a little bit last time. Most of us come into this business wanting to rescue people. In general, I try very hard not to, in especially these intense circumstances. And then we talked a little bit about the trauma triangle, about how enactments within this can really get us into trouble. Part of 2 is letting go of your agenda, and we're going to see several examples of that today. How to help somebody is usually first centering yourself on the patient, and really seeing what they might want from the encounter. I see this in trainees quite a bit. So we're going to pay attention to our feelings. I talked about that as the first initial assessment. How do things feel to you? And then this is where your validation mechanisms usually come in. Watch your frame, which is about how we engage with the patient. So if you see yourself deviating from the normal, then you really ought to start thinking about what sort of enactment you might be in with the patient. Are you trying too hard? Are you trying too little? Both of those should tell you something about the patient. Don't be too rigid in your rules. Sometimes you break the rules. Sometimes you're going to pay a price for those breaking the rules. Avoid authority battles, especially with anybody in the cluster B land. You can't win those, is the reason why you need to avoid, because they cannot tell the difference between a surrender and a submission. To them, submission is a shame-based enactment, and they will do anything to avoid that. Set your limits without being a moralist. And we're going to see some examples of that here today. And then we talked a little bit about the difference between shame and guilt last time. Shame is the embodiment of badness, as opposed to I've done something bad, which is guilt. It's still an action as opposed to a character flaw. Rule number 8, talk it out. Talk to somebody about this case, and work through it with somebody. And I've got some videos. So I'm going to show these videos. I'm going to stop sharing for just a second. I'm going to show these videos. You guys are welcome to interrupt me at any point. I don't mind if you have a question or a thought about what we're talking about. All right. Any questions so far? I guess just to say. No. All right, let me pull up the video. So I was going to use, actually, let me show you a picture first. I was going to use Griffin videos, but they are so darn hard to hear. I do have a couple of pictures, but I'll show you those. Okay. All right, this is in admissions. And I'll give you the backstory of this. The patient is right in the middle of these 3 people. I don't know if you can see my cursor or not. I have his face blacked out. There's another patient in the corner minding his own business. His face is also blacked out. So this patient was being pretty loud, and the fire and safety officer, there was just one fire and safety officer. And then he was continuing to be kind of angry and loud. And so 2 more fire and safety officers arrived. What do you notice about their positioning? Well, they have him triangulated. He's in the middle of 3 people. This to me is a pretty big no-no. If somebody is feeling threatened, they, like anybody feeling threatened, there's only a few reactions to that, fight or flight or freeze, right? And so he, shortly after this picture, punches the one to his right to our left. And so when I review these sorts of videos, I try to tell our folks, there were actually a number of mistakes made here. One was they're too close to him. And their verbal de-escalation stuff was not great. He was asking to leave, and they were not being particularly kind about that. I mean, they were being mean, but they weren't validating his wish to leave. It's really not hard to validate, but it is not a lot of people's first mechanism. Okay. All right, we're going to watch a video. Oh, this is from the Columbus Police Department of Ohio. And I chose these videos because Griffin videos are too hard to de-identify patient data. And so, and they're also really hard to hear audio wise. So we're going to listen to some police, and they posted this on their own website. They're very proud of this video, and there's some reasons to be proud. So I don't mean to criticize them too much. But I think they could have done a significantly better job as well. Okay, so we're going to listen.
I just want to be in my own house.
Okay.
I don't want to go home right now.
Okay. So, hey, what's going on? Just talk to me. What's going on?
My God, you don't want to hear this.
I do want to hear this.
Because am I open a can of worms?
Okay.
That's really bad.
Tell me what today is.
Okay, I'm gonna pause just right here at the beginning. So in the beginning, what can we say about it, right? I can say I'm not afraid of her at all. She's not particularly excited. I don't get the feeling of any danger here. His tone is pretty good. He's asking a pretty good question about how she's doing, what's going on. Now, which I thought was really good. What I would have added here is a better pause to let her answer that question. Always Dr. Yalom or Yalom, who's a really good writer about psychotherapy. His initial question is always something like either how can I help you or what ails, which I really like. I thought his question was pretty good, but he's very quickly going to an orientation question, which I find unnecessary. I don't care if she's oriented. I feel like she's not delirious right now. Not so much that I'm really worried. All right, I'm not sure what's really.
Yes. What's the date today?
That's fucked up. That's fucked up.
So that is a second rule violation about his own agenda. He wants to know if she's sick or not, as opposed to identifying what her primary problem is, like, to her. And you're going to notice her reaction to it is not great.
Boy, that's fucked up.
Sir?
It's like 30th. I mean, it's the first, it's the second,
You're
the
close.
second, it's the second, it's
You're
the
close.
second. I got my fucking social security check, it's the second now.
What year?
I'm waiting on my goddamn third to get my other check. What year? 20? Do you have 20/20 vision?
No, I don't actually.
I don't either, I'm blind.
All right, so hey,
And sometimes I wish I was blind because I wouldn't see the goddamn ignorance and nastiness.
So now, I think a lot of people would have attributed just this to her mental health. I think her intensity here is directly related to his question. He started with a really nice tone, but followed it up with things that she didn't really want to talk about, didn't want to answer. So she got more intense. It's not a huge problem, but in general, I stick with whatever the patient wants in the beginning to try to create better rapport.
Here.
so hey, listen, I need you to calm down, okay?
No, I'm calm.
I think that's not a great phrase, by the way. If you can really own your own actions in your own space, and believe that somebody's negative interactions have to do with your approach, you could say something. You could own your own mistake. You could say something like, maybe I didn't ask the right question here. I'm sorry, or maybe I said something you didn't like. And again, I want to push her back into the realm of talking about how she feels. I doubt he would see it that way, but that's how I see this interaction becoming more negative.
All right.
I'm calm.
You'll also notice.
I wish I would have spit in my daughter's ear, and I wish I would have threw it.
You also notice that the officers have her triangulated like my fire and safety officers did, which I think But and these are police officers, so I understand why they do that. They have a much more dangerous job in some ways. They don't, you know, they don't understand or they don't know what's going to happen next. So, but in general, I wouldn't do that.
And I wish I would have pressed her. I killed her and her daughter. But I don't wish that because I took care of the baby. If it wasn't for me, that baby wouldn't be alive right now.
Stacey, can you talk to me for a second? Listen, this is what I want to happen because you're very excited right now.
No, I'm pissed.
Oh, you're pissed right now, and you have every right to be.
I think that is a great validation right there. He tries to identify her primary emotion. She corrects him. He allows it to be corrected. You'd be surprised how many times I see an intern not allow the correction. They'll say, "No, I actually think you're this." But does a good job. It's a good question. And watch her change. She gets a little nicer.
You don't piss.
What's that?
I said you don't piss.
I do piss.
Yeah.
Okay.
Well, I'm pissed.
All right. Well,
You have the beautiful teeth.
thank you. I appreciate it. So
That's
listen,
like a shining angel.
listen,
You don't smoke, and that's why I put my cigarette out.
I don't.
Ask a great question. The patient gets nice. That's just how this works for me.
I don't. What I want to do is I want to remove you from this situation.
Okay. Can I just sit here because this is my best friend?
Well, the problem is that it's so close to your daughter and her boyfriend. It's just going to escalate. You see what I'm
Okay,
saying?
I can walk away.
Okay. What I would rather do is take you to like, hey, just you didn't even hear me yet. Where would you? What do you think I was going to say?
I like his
What do you
tone
think I was
here.
going to say?
He's light.
Not Riverside. Huh?
Psychiatrist, net care, or whatever.
Have you been to OSU at all?
Sorry, I don't have fun. So don't worry about it.
That's a good way to live. Have you been to OSU ever?
Listen, please don't do this to me.
Do what?
I didn't do nothing.
Okay.
I'm just a little intoxicated because I went out a good time drinking beer.
Okay. When's the last time you ate?
I ate like for real 20 minutes ago, some shit down in Tammy's basement.
Okay. When's the last time you slept?
I like these questions a lot more than the orientation questions that he was asking earlier. I feel like they are asking about her condition and they're easy for her to answer. You know, they don't try her in any way, shape, or form. So, oops, sorry. All right, let's keep rolling here.
Probably 7 hours ago. I was
7
at my
hours ago?
mom's. I was at my mom's cleaning up and sleeping and get my appointment from my North Central thing, and I just got
North
out.
Central. So you take? Have you been taking?
Got out of the hospital because they lied on me.
Have you been taking your medicine?
That is a super common question that I see. I don't like it. Have you been taking your medicine? It implies, you know, that you should feel ashamed of not doing something. I don't ask it. If you want to ask a question like that, I really think you ought to say something like, you know, I understand you're on medications. How have they been working for you? Because part of the reason why people stop taking something is, of course, it's not helping them, or they don't like it for some reason. And really, I don't care about so much, you know, if they are or not. I mean, I do care, but I would really rather know why somebody is not taking it. So I think if you kind of approach that differently, you'll get a better answer.
Have you? Honestly?
Where?
Okay.
Right in the God.
When's the last time you took your medicine?
Just like 3 hours ago.
Okay. So.
But I know I'm not supposed to drink on it.
Okay. So you know that can affect your medication, right?
But
so,
but it makes me feel better.
Okay, I understand that. But if you're taking your medication, what's your medication?
Visceral and Abilify and Bistropian and Ambien.
Okay. So these are all anxiety and mood medications, right?
No.
Most of them?
No, it's bipolar.
Okay. So, hang on.
No, I'm just like
I would probably
back pain and knee.
I would probably validate that right there. I mean, she just corrected you with her diagnosis. I would just allow that to be, oh, okay, you know, you have bipolar, that's fine.
I sprained my knee and it's hard.
Okay. So if you're taking
when a patient gives you a physical complaint like pain, you know, it's like Christopher Bolus says about, you know, a patient comes into the psychiatrist or therapist office and says that they're tired. Tired usually means depressed. pain. What does pain mean? Whether there's something in them. She's talking about physical pain, but there's some sort of emotional pain. It's usually easier to talk about physical pain. I tend to validate those statements and say something like something like, you are in pain. I just try to recognize it. You're in pain. And if they're more with it, I'll say something like, you have physical pain for sure, but the thing that's hard to talk about is emotional pain.
These mood regulators, and then you're drinking alcohol on top of that, it's going to affect your mood. But you understand that, right?
Yeah, but I'm in a really good mood right now.
I'd love to be in the mood that you're in right now.
So that now he's trying to tell her to not drink alcohol, which I think is a little bit judgmental. And she just gave a very great reason why she would like to drink alcohol. Makes you feel better. And I think it's easy to validate that. You must not have been feeling very good before you started drinking.
Unfortunately, I have to. Can you make sure she doesn't?
Listen,
Please.
I'm really scared of you guys because you guys always do this to me and you don't believe me.
I'm here for you. I'm here to make sure that you're.
I'm in a catch-22.
Okay. All right.
So she's
Okay.
It's hard to make out exactly what she's saying there. It's something psychotic about her daughter, but so she's talking about being scared of the police, but also scared of her daughter. You're going to see maybe in a little bit why she should be afraid of these children. And it's not an irrational or invalid fear, even though these guys are trying their best to be nice and to do the right thing by her. I think what we're going to end up seeing is an enactment of that's kind of not great.
Okay, I understand. So again, yeah, I get it. I get it. So
I just didn't want you.
Now, I get why police officers might want to keep the distance. I have a couple of problems with how he did that. One, he did it from an authoritarian stance, that I'm telling you to respect your distance, as opposed to asking her. I would say, if it was me, I would say, hey, I don't feel super comfortable being this close. Would you mind if we have a little bit more distance? And it shouldn't come from him. It should come from the officer doing the talking. He should be the one to set boundaries. You really shouldn't rely upon or need somebody else's interaction. In fact, if I was doing the talking here and one of our officers said that to a patient, I would be pretty mad about it, because I need to control my own distance from patients.
You to hear what I just said.
okay. Hey, Stacy.
You have the most beautiful.
Thank you very much. I appreciate it.
Hey, Stacy.
You take care of yourself like that, and you too.
Thank you.
I mean, all you guys do.
Hey, Stacy. Listen. Okay.
And I fear the police.
You shouldn't fear us because we're here to help you. Okay.
I think you
So
guys
she
are so
fears.
beautiful
She's
and
saying it
beautiful
in the
and
third
you train them
person.
so well.
So Stacy, I'm gonna cut.
But she's really just afraid of that dude right there, is my guess, because of his aggressive posture there. I know it's not super aggressive, but she felt his authoritarian stance there.
Straight to the chase, okay?
They said I don't need to go to the hospital.
Okay, so
I'm a little investigated. I'm having a good time. Jamie is my best friend.
Stacy.
I've lived here for 5 years. We've had 5 years of history.
Yeah.
Stacy, listen to me. I don't want to take you to jail, okay? You're not gonna go to jail.
I don't want to take you to jail is not the same thing as I'm not going to take you to jail. Just for the record, I don't love that. She says, I don't want to go to the hospital. I don't need to go to the hospital. This is probably where I would start to work with her on what should happen. What does she want to happen? She's going to say nothing. I want to stay home. And I'll say, but things are not going well. So what could we do? I just want to start to problem solve and involve her in the decision making. In general, with most patients, not all of them, some people come in pretty sideways and can't really participate in talking, but she can. And I would really start to walk her down. Is this the worst she's ever been? Is what's been helpful in the past? She's going to say the hospital's never been helpful, but I might plug it, that a little bit and say something like, how many times you've been in it and you never left there better than when you came in, and get on the road of trying to work on that and get her to thinking about it. what's she really afraid of in the hospital is another thing I would be working on.
Don't take me to the middle hospital, take me to jail.
Okay, what I want to do, I'm not taking you to a mental hospital. I'm taking you to a hospital because
But listen, they're going to put me in there for 2 weeks.
So that was a disingenuous statement. I'm not going to send you to the mental hospital. I'm going to send you to the quote regular hospital. But we all know what's going to happen when she shows up in quote regular hospital. She's going to be then sent to a mental hospital. I don't lie to patients, not ever. I always am as transparent as I can be, because I don't want them ever to feel tricked in any way, shape, or form. I'm really honest. I say things like, you know, we can't really come to an agreement here about what should happen next. Unfortunately, I have to err on the side of safety and you know, make sure that you come into the hospital. I just tell them up front. It usually goes fine. If I don't think it's going to go fine, I'll get my backup ready first. But in general, I talk most people into going to the hospital.
no, they're not.
Listen, yes,
That's
they
not
will. Yes,
necessarily
they
the
will. That's why last time I was caught up.
Okay, but here's the thing. I want to make sure that physically you're okay, so that's your blood pressure. That's making sure.
Please, I'm fine.
Okay, but
Listen, I get.
You've been drinking, you've been taking your medication, and it's messing everything up.
No, it's not.
It is. You were talking about catch-22. You were talking about seeds of the earth. A normal person. I'm not saying you're not normal.
No, you're fucking retarded black boy.
I don't like that phrase, a normal person. I think it's a mistake. Now, so he's made several mistakes here. He was talking about, I don't want to take you to jail, which implies that it could still be an option. He's being judgmental about her alcohol use. He just said a normal person. If you had to guess, what would you guess her reaction is? Sorry, I'm just checking to make sure nobody's chatting to me. It's going to be not great, right?
I say,
you see what you just
I
said?
say what I mean for you to understand, but you didn't get it right. Is that it don't matter who plays the seed, it's who raises the seed, black boy.
Okay. So
okay.
So now she's her intensity and anger is
the mood
increasing.
just all over the place.
Look, you don't understand.
Okay.
Okay,
I'm
you
trying,
don't understand.
But I'm trying to understand.
Listen.
Uh-huh.
Every dog has its fucking day.
Okay. What does it have to do with today?
I've been lied on. I work my ass off.
Okay.
I'm a maid slave to the earth.
Okay.
I work my ass off for the baby. If it wasn't for me, that baby wouldn't be alive. That baby wouldn't be alive.
Stacy, I really.
So what do we do with statements like that? She's saying things about herself and her value. I think this is a great opportunity to validate her value. You're a hardworking lady. You care about this baby. I don't even know which baby she's talking about, but it doesn't matter. I think that again will build better rapport with her, and you know, and I might even use that to transition. You know, because you need to be able to work and because you need to be able to take care of these kids, we need to make sure you're in good shape too.
Really want to help you, and I really want you to go. No, you don't.
I do.
Want to put me in the mental hospital just because she lied on me. She said I spit in her hair and assaulted her. She told me she was going to tell them that.
If that was the case, you would be in handcuffs and you'd be going to jail. That's not the case.
So why are you here and why are you trying to get me to go to next year? I'm having a good time with my friends here. I'm free waiting 20 fucking one. Why can't I have a
We want to take you to OSU.
That's all we want to do is make sure that you're okay. That's all.
Just for a mental evaluation. It doesn't mean you're going to stay for a couple weeks.
So she gets more intense because they're making their move here.
Not only
starting
are you
their
drunk, but your
wind
mood
up
is
here.
all over the place.
Nigga.
Oh gosh. We try to do this the right way. Relax.
Your skin is so beautiful. Your skin is so beautiful. I envy your skin. And your eyes. I can see through those things after. Take them off just for a second. Or are you scared?
Here, put your hands together like you're praying.
You're probably sick. Your friend probably makes you sick. Listen, don't hurt me.
No, here, put your hands. Here, put your hands
There you go.
Like this.
It's okay.
Really fucked up, y'all. I ain't even do shit. I always get fucking tied up in some bullshit.
I want you guys to see.
No way, that's fucking me.
It's okay.
Why do I need my room? Because like, really fucked up, you guys. Can I go in that one? That was for here.
Okay.
So she asked if she can go into the first police car. Do you see the last police car? That is where they are taking her, and she probably gets a sense of that. I don't know why they won't allow her just to go in the regular police car, but they don't, and you'll see where they do take her.
That's okay. I get light on, and I'm not allowed to drink, right? I'm not allowed to get my nerves
So
down.
this to me is a pretty scary looking vehicle.
It's okay.
Her reaction to it is, of course, not good. I mean, it looks like a punishment vehicle, for some sort of serious offender to me. I would not want to go in there.
Alright, now, would you like to lay a sheet out? Tammy, give me a blanket so I don't get the cruiser infected. COVID-19.
So she's asking for a blanket. I would definitely have given her a blanket.
She's gonna get you a blanket. You done? We're gonna sit up here, okay? All
As
right?
far as
Ready?
I know, that she does not get that blanket.
I'm not done. Can I have 2 minutes?
Sure.
And maybe he meant that he was going to give her a blanket. I don't know. And
Thank
just
you.
forgot about it or something, but they don't give her one.
Hey, can you not like?
Please go back over to the house, please.
Okay. Are you ready now? Okay.
She does go in there kind of voluntarily-ish.
All right. Have a seat. Good job. Good job.
Tammy didn't get a blanket. Tammy didn't get the blanket.
Again, she's asking for the blanket. All right. Well, I think again they present this as a pretty good interaction. I think it could have been a bit better. Does anybody have any thoughts about it? No thoughts. Do I have any psychiatry residents here in the audience? Would you admit this lady if they brought her to you? No volunteers. I don't know that I would actually. I might not. I'd like to see how she did in our admissions waiting area. I might give her an antipsychotic and let her take a nap and see how she's doing in a few hours. And if she, kind of cleared up okay, then I'd let her go with it as long as she had a decent, outpatient follow. And then I would just talk to her about how she ended up in that state. Okay. On to the next video. Okay. Here we go.
Please let me fucking fix this.
Eric
They're telling you everything, and then right
John,
now, I've told you about
John,
everything.
Eric is
It's
just
on the fucking news. Going
Eric is
fly
just
speed.
concerned about you. Okay.
Doing that is concerned. What are you?
All right, so that initial interaction would have frightened a lot of people, but I was not frightened by this man at all. I felt like he was just trying to demonstrate physically how he's feeling. Again, I might still take a step back, but okay, now we're gonna fast forward it.
He's very in and out. So 1 minute he's calm, 1 minute he's not. Can you sit down for a minute? No, there's
get the
not.
other dog?
I'll explain to the cop real quick, man.
All right,
You know the thing that's going on today?
No, can you have a seat
I
here,
got it
buddy?
on my phone. I don't know how, man. That's all it was.
Okay.
My daughter's accusing me of being on something, man.
Okay.
I've been trying to fix it all
All right.
fucking day.
Listen. Take a deep breath. What's going on?
All right.
Right.
Pretty good tone and a pretty good question from the patient. He's patient-centered about asking the patient what's going on. He's going to lose containment here a little bit with the daughter, but
Don't tell them that. She don't understand them. She's telling them the whole world. What's that got to do with that?
so as soon as I see this interaction, I kick daughter to the curb. He doesn't like something about what she has to say. And again, my quest is never for the truth. in terms of some sort of objective truth. I want to hear what the patient has to say, and I'm trying to create some sort of relationship with the patient. And eventually we will get to what they think the truth of the matter is. And if they're lying to me, then I'll bring that up. But I don't really need daughter's help here to do this. Like she wants to say from her point of view, what is the truth, which I don't care about right now.
No one's
I want to fix this problem so everybody don't hear what I'm saying.
Okay, so sit down. So no one's trying to
Look,
get you in jail. We're
they
trying
hear
to
everything she's
figure
saying
out-
is what I'm saying. I'm trying to have a conversation with her, but she's telling the whole world what I'm saying, and they hear her accusing me of shit.
It's a police officer, okay?
I know it's a fucking police
So calm
officer.
down. So we don't escalate.
Okay, I'm calm. Now what?
Now be quiet.
Okay.
I got a call saying that he was lashing out. The neighbors had heard it.
Yeah, because I was trying to get them to fix it too.
How about you come inside with me and then you talk to me?
Please tell her, Donnie, I'm fine.
Okay, come on.
She won't fucking believe me, man.
Come on.
I'll talk to them while you're
I got a
talking.
call from him, from my family,
All right.
saying
Yeah, stay out
I
here,
didn't
buddy.
do anything, man.
No
I'm
one
not
said
going
you
back
did
doors.
anything.
I don't do nothing.
Okay.
Daddy said
All right.
he got something from somebody.
He-
He self-medicated.
You heard him
Santa.
say a minute ago that she's telling the whole world what I'm saying. Now, I mean, you could dismiss that as a psychotic statement, but she is in fact currently telling other people, and he could just be expressing his displeasure about her telling his story, which I think is a normal thing to be upset about.
Axes, and this is the first time this has ever happened, so I'm thinking he got something bad and he's getting paranoid.
I'm not on fucking that's on the TV.
So
I
he-
just want to make sure he's okay, Daddy.
Okay.
He just keeps getting more intense as she does this. I think it's, you really got to get rid of her.
Please
Okay.
tell her it's on
He
TV
thinks
because
the
they can
TV's
hear
talking to
you.
him, and there's something going on.
It's a group text, man. I didn't know how to fix
I
it.
don't know if he did his Xanax or if he's having a mental breakdown.
It's okay.
Okay.
This is a first for him.
I
He's
see my
not
lighter.
okay.
Please get
He
my
says my
lighter.
brother was killed 5 years ago, and he hasn't been the same since. So he's mentally not okay.
Okay, that's an important piece of data. This man has lost his son.
I'm okay, goddamn. I did everything I'm supposed to do
All right.
today,
I don't
man.
know.
And you're hearing that
All right,
whole
can you-
world's listening
all
to
right.
what you're saying right now
And
because you're standing next
He
to
has
me,
been
right?
normal up until this day. He babysits my
Oh
son
my
every day.
God.
This is not normal at all for him.
Okay.
So
You're wrong. You won't realize how wrong you are when this is all over.
yeah, it's wrong.
Listen, they're telling what you're saying on the news.
Yeah,
Look.
it's
okay.
wrong.
It's
wrong.
okay.
Is it done?
Because they're
okay,
gonna-
now let's talk.
Okay.
I'm ready. Will you please step aside?
Okay.
That's cool. You didn't
All
believe
right,
me,
can
but
you-
you're going to be bad when you hear what
Get that
happened.
inside real quick.
You're going to be bad when something
Yeah, so
happens.
good.
when
He
you find out what
separates
happened.
separates them out,
So
which is
anyway,
what I would have
gentlemen,
done.
Okay.
Obviously, everybody got the mask. Can you still hear me?
Yeah.
Is the news still typing it? Look. It's on my phone. It's on, my,
Okay,
it's on the
just-
TV.
just-
Look.
just-
No, you look. He
just-
won't bite you.
I know. Just stay right here, buddy. What's your first name?
That's a good
I
question.
got a group text.
Okay,
I
what-
guess, what is it? 315 send or
I don't know. What's your first name, sir?
Johnny?
John.
I'm clean as a button, bud. I ain't done nothing wrong in fucking 20 years.
I didn't say you have.
And my daughter comes in here and I take a Xanax every now and then. Put me
So I think it's a really great question to get to somebody's name. Now, what he doesn't do is introduce himself here, because usually after somebody gives me, their name, I'm going to say who I am. I usually would probably open with that. Hi, I'm Dr. Morris. But
sleep, man. That's all I do is go to sleep and go to work.
Okay. Okay.
And since she knows I take a Xanax every once, I don't want to. I'm drunk. You can ask her. You don't see.
Did you take it last night? The Xanax?
Yeah, last night. Yeah,
Last night
Okay.
you did.
Yeah.
Okay.
see, now
Yeah,
this
on the
is
same place
immaterial
every
to me,
time.
whether he took his Xanax or
I
not.
was
I
just trying
don't
to figure
care.
it out.
Yeah. Well, listen. We're not accusing you of anything.
They are accusing me because it's my
Okay,
fault.
okay.
Because I didn't.
I also don't like that there's a second speaker that's doing that. I try to create one line of communication in general for me. I try to get rid of other people. I don't want three people talking to a patient at one time. I feel like it gets too intense. And there's a moralism in that, which I don't like about taking the Xanax. Like, what do I care if he took a Xanax last night? I don't think that's the root of this problem.
How to let go of the fucking tape.
We're not. We're just here to talk to
But
find out what's going on.
Dude.
Okay.
Listen to me right now. I don't want to have a conversation with the whole world putting in the sky what I said. Because it's connected to my phone. It was a group text from. They send it. I get it. I'm supposed to send it on to share.
So when I hear somebody, this sounds psychotic, right? Like, the whole world's listening to me or whatever. I try to hear that there's some sort of truth in that. When he's saying the whole world is, listening to me or looking at me, maybe he just means right now that there's a lot of people here looking at him. And I might ask him if there was a way to help reduce that feeling. You know, it feels like a lot of stuff's going on here. Is, you know, it would be helpful to have these other folks step back, or maybe I'll just do it without asking him. I'll just say, hey, why don't you guys step back a little bit? Because again, that to me is a complaint. Now it comes from a psychotic place, but it's a real complaint potentially.
Right? Well, I put send and not attach or some shit to send it, to forward it. And I don't know how to do that. So it sticks to my phone if I don't send it. You know what I'm saying? And that's why I'm here. And if me being right here, if I push a bunch of 5s, the cars will take it that way. But I'm trying to push the one that I got this morning, which was MMRR.
So he goes on in this psychotic stuff. And what I would be looking for here is a way to validate anything I could
But I hit the
could
send
do.
button and it would keep me. It wouldn't let
Maybe
go
I'd
of
say
it.
something
And I
like,
didn't know
you're
what
trying
was
really
going on.
hard to figure
And my
this thing
phone
out.
died, and I'm trying to get home to get my phone plugged back in to try to fix it because I knew it was happening.
You're trying to fix things. You know, again, I'll be generic because I don't always talk
asking
about it.
everybody if they know how to fucking fix this. That's all, man.
Okay. Has anything like this happened before?
No, man. I'm not a fucking idiot. I'm not fucking losing it. I know you didn't say that. See, I'm on it.
So I don't like that question. Has anything like this ever happened before? I mean, it's not a terrible question, but I don't think the frame is solid enough to ask that question. He is not close enough to this patient. He hasn't validated him. It hasn't felt like he's been heard.
I'm not an idiot. I'm not on drugs. I'm not fucked up. This ain't me. I don't say he's not on the front
And
porch.
he's being defensive about the drug thing because of the daughter and this other officer.
Okay? My daughter comes in here, and I'm already upset, hyperventilating, and she hears, what's going on? I was just like, Erica, hang on. And she's like, why'd you do this? Why'd you do this? Why are you doing this? Are you okay, Daddy? Are you okay? Yes, I'm okay. And then I'm trying to avoid her because me and Dominic was working on getting released because my nephew knows what's going on. And he's out here trying to guide the thing so it won't come around here and hit me.
Guide what thing?
My nephew. The thing is flying in the sky today. The fucking birds. The fucking...
Oops.
This shit. Everybody's supposed to fucking receive a text and share it and send it to lose it on. It don't make sense. Do you understand what I'm saying, sir? I'm not.
I mean, not completely.
I'm just.
No.
I'm not in this stage because I'm.
See, he's asking if you understand. Like, I don't think you have to fully understand what a patient's saying in order to respond to that with something. I wouldn't say no to that question. I would say, I hear you saying, you know, that you're trying really hard and that this is really upsetting to you. You know, I would validate anything I could out of that statement.
Neighbors are hollering at me. Everybody knows what's going on. I'm trying to do it. The lady, I think I couldn't. I could hear her voice, but I couldn't see her. I think right there, the next door lady. She said, "I think you're on heroin." No, I'm not. Motherfuckers are doing everything I'm saying because it's up to me.
192 is on your left, 192.
And I try to get that done for me. My
The other thing is you're going to see quite a bit in this video is their radios, which I don't know why they don't turn them off.
And she's like, I don't give a fuck what they say. That's all. And I just got uptight because what you're saying right now, Eric, is going out and fucking live stream, man.
It was Richard, right?
It's John.
John.
Do you understand what I'm talking about now? Please.
John,
And that's
John,
one reason I'm in the
John.
States because it's been going on for 4 fucking hours.
John, take a deep
I
breath.
didn't do
So I
this
think
shit
we
on
can validate
purpose, man.
All right,
very
John,
easily.
take a deep breath. Take a deep
I
breath.
know that you didn't do this
And
on
in the
purpose.
news, and in the news, oh, John's on this. Oh, and then, you know, the fucking car wash, all these, oh, we're getting car washes for days, John, thanks. You know, we all stick together, Columbus, but it's not me, man. Where you get my coat, please?
192,
The
that
coat.
star you can respond to.
I know, I'm sure they are. I don't have that kind of money. What do you think I would do that? And then I'm trying to lead you to my address? Ask my nephew. My nephew's been out there trying to fix it, man. I didn't do this shit on purpose, man. I did not do this shit on purpose. I accepted a fucking text. I was supposed to fucking forward it so somebody else would text it.
All right, copy, thanks.
Okay, how old are you?
Who that hurt? 55.
55. Been married before?
Yeah.
Okay.
Recently widowed.
Oh, I'm sorry.
Thanks.
And that's your
So
only daughter?
in a question like that, he's recently widowed. So now we know this gentleman has 2 big losses. He lost his son a number of years ago and his wife. And if you know, kind of, if you've ever seen somebody go through a psychotic grief, this is maybe what it looks like. He is not doing real great. He does say he's sorry, but there's not a huge empathy response there. If I thought he was well enough and if our relationship was well enough, I would say something like, you know, I wonder if that has something to do with how you're doing today.
Yes. Okay. I had a son, and you guys know the Andersons got killed.
Yep.
That was
So
my
your daughter
kid.
lives with
Yeah,
you? Or
he
no?
just,
my daughter,
the officer
Erica.
kind of,
She lives with
My love, beloved Erica,
Yeah,
my baby girl.
does
the only one I got
love.
left.
Does
Yeah,
she
hey,
stay with you?
And she's jumping on me, and I do everything to fucking make her happy. And she comes in here, what do you want? What are you doing? I'm fucking freaking out like, Erica, please let me fucking fix this.
know, Erica's
They're
just-
telling you everything, and then right
John,
now, as I've told you guys
John,
everything,
Erica's
it's on
just-
the fucking news.
Eric saying.
It's a live feed. It's going out in the air. I'm supposed to release it. You're supposed to go mmrrgg.com and release it. Well, every time I send it, it would come back to me. And I didn't know how to, I guess you
So
had
in
to
an-
attach
hang on, let me see what
and send. I didn't just know how to do that. And read it. I couldn't fucking see it. And then once I did see it, I would send it, and it would.
So he's talking about a lot of
tell me
psychotic
right now.
stuff here.
You don't hear that?
And he asks,
I don't.
he asks
it?
if they hear it, and they say, I don't. I would ask for a greater description of what it is he's hearing here. Tell me more so I can try to understand. Now, later on, he's going to talk a little bit about their radios and how they're bothering them. I don't think that's exactly what he's referring to right now, but okay, let's see. Let's go way forward here. We're running out of time. Let's go to.
Did I do it? I haven't been able to have it because this helping.
Tow truck work gotta be good.
There's a new officer that comes in.
Oh, I do that in the winter when I'm
Proto
not,
always comes
work.
for us. You gotta go work for Proto. They don't show up
I ain't
everywhere.
gonna start now. Since starting now, ain't no fucking pension gonna be now. So I mean, I try. But yeah, I just got my seal coat on. I do that every year. Me and my son started that shit.
Oh, did you just?
Yeah, he got killed. That's when we all went to hell.
Yeah.
I'm sorry, I didn't know about your son. That's
My
all.
whole family got killed. They know about it. The Andersons on terrace.
So you'll notice when he's talking about the actual problem,
My granddaughter.
he is not
not at all. My son.
upset. This is what needs to be processed here, right?
Absolutely, that's awful. Have you seen
I'm not
him?
gonna show you. I don't know how the fuck with these fellows have been trying to get the Social Security shit to go on and all that. I'm just done, man.
Hey,
After my kids got killed and my wife died right after that.
Hey, John.
This is a pretty good place to start doing your transition.
John, have you talked to anybody?
And
else
she
who's
does it, you know,
dealing
about
with
getting
grief?
him some treatment.
Do you see a
6
grief
years.
counselor? You need a grief counselor. You need a
Nothing
grief
wrong with
counselor.
that at all.
Good.
That's traumatic. You probably have
But I try to
PTSD.
get help. Everybody says I'll help you, but I'm not gonna ask every time. I'm not gonna ask 20 times a fucking month.
Hey, John.
All right, let's maybe stop here. He ends up going with them pretty, you know, reasonably. They do cuff him, but often police officers cuff people just because they always do. You know, in the state of Oklahoma, we actually have a transportation company now, but they, I think, may still use cuffs. I'm not a huge fan of that. I get why they do it, but too many people with traumatic enactments. Okay, so there's case number 2. We don't have really time for any more, but is there any questions? This is just kind of some ideas and general approach. Neither one of these patients are actually particularly tough. I would call these garden variety stuff that we see walk in. That is, you know, somebody with that has psychotic symptoms in both cases. Would I admit him? Nah, probably not. Again, I'd like to see how a medication could calm him down and work on his psychosis. And maybe I'd watch him for a while. And we have those crisis beds, the 23-hour crisis beds. Maybe I'd watch him for 5 to 10 hours and see how he does. If it got worse, of course, then I might have to do an admission, but I didn't see any particularly upsetting, except for he does have a psychotic symptom that's pretty bad. So I'd definitely try a med for that. And then processing his grief, which, like I said, when he really comes down is when he's talking about the real problem, and that is often the case. Diagnosis. The first lady, what do you think? Somebody gave her the diagnosis of bipolar, but I think she is a personality disorder. This gentleman, I really think he's having a psychotic reaction in grief, in the world of grief. And now maybe he's on something too, in terms of something that might make him psychotic, but I don't know. I've seen people be pretty psychotic in stages of grief. It could be pretty intense, especially the loss of a child. Okay. So I wanted to offer this again. If anybody wants to ever process some of this, patient interaction, I would be happy to. I talk to residents all the time about such things. So please email me, or if you want my cell phone, I can give you that too. Okay, I think I'm done. 10 till. In the psychiatric world, 10 till means you're done. Unless somebody has questions.
Well, thank you, Dr. Morris.
You're welcome. Thanks for inviting me.
Appreciate it. Thanks for coming back.
Oh yeah, happy to do it. Thank you.
Looking forward to another presentation in the future.
Yeah, thanks.
Thanks.